Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Multiple sclerosis, we are looking at the initial symptoms. So we'll be moving on from the very most common symptoms to that of the very rare symptoms. So the first one is the sensory loss. The sensory loss is very commonly associated. So sensory loss, if you look at the percentage, is going to be 37. Then comes the ON. ON means the optic neuritis. Optic neuritis, it is amounts to about 36% of the cases. Then comes the weakness. So the sensory loss and the optic neuritis. Then comes the weakness. So this weakness is present in about 35% of the cases. Then comes the parathesis. So parathesis, if you see parathesis, the percentage is about 24%. Then comes the diplopia. So what about the diplopia? So diplopia, if you see, it is about 15% is present as diplopia. Then comes, what are the other features? There is ataxia. There is presence of the vertigo. So there is ataxia, there is vertigo, there is paroxysmal attacks. There is ataxia, vertigo, paroxysmal attacks. So all these are in the ratio 11, 6 and 4. I mean percentages. And then when you look at the bladder is associated with the 4%. And then we have some minor percentage of, there is the lermite, pain, dermatitis, visual loss, there is facial palsy, there is impotence, myokymia, epilepsy as well as falling, So all this is, it represents 1% individually. And when you look at visual loss, it amounts to about 2%. Then dementia, it amounts to about 2%. Then pain amounts to 2%. Lermite, it amounts to about 3%. Pain, it amounts to 3%. To learn and grow daily like this, please do subscribe.